I get asked all the time, what does an autism evaluation actually look like? So today I'm here to tell you about what that process looks like. So the testing process looks very different depending on the age of the child or an adult, as well as the complexity of the case. But typically, all processes start with an intake. During the intake, we're gathering necessary information about history, symptoms, concerns, needs, so that way we can really make sure we're tailoring our evaluation to the individual. The next step would be when you actually show up on the day of testing. And so this again varies by age, but we try to look at cognitively how someone is functioning. We're looking at using gold standard evaluations such as the ADOS-2, the MIGDOS, and many more. And during this part of the evaluation, that's when we're looking at how someone perceives the world. We're looking at how they socially interact with us, how they communicate. We're also looking at sensory needs for that individual. And we're also getting a bunch of collateral information from parents, or if they're seeing a speech therapist, occupational therapist, teachers, so that way we can take a collaborative approach to see what this individual may need, not only what we're seeing in the testing room, but beyond that. So that way accommodations can be put into place. How long does testing take? That really, again, varies by the individual. But what the process kind of looks like, it could be as short as just the morning session, which is common for my younger kiddos. But for as kids get older, there may be more complex issues, maybe looking at things like ADHD and anxiety that may be co-occurring, or learning disabilities. And so that may take the full day of testing, or it may have to happen across a series of sessions. Again, it's all tailored based on the individual and what they need. Another question I often get asked is testing stressful? Of course, testing can be anxiety provoking, but what we try to do at Mindwell is really make the person as comfortable as we possibly can. We can use fidgets, sensory objects to make them feel more comfortable, as well as frequent breaks, whether that be for snack, the bathroom, or just to get up and move around. So if you are considering an evaluation, we highly recommend you come here to Mindwell. It's one of our areas of specialty, and we are happy to tailor the evaluation process for the individual and make sure that you're comfortable throughout.